Hello, my name's Sandra Williamson and I'm one of the surgical site infection surveillance nurses in our trust. There are three of us, two work at Carlisle and one at West Cumberland Hospital. Our role is to monitor anybody who has a joint replacement in our hospitals. Our main concern is that wounds healed and we get no infections in your new joint. Collecting surveillance and data is a legal requirement for all hospitals in the UK who do joint replacements. The SSI nurses monitor and report infections which occur in hospital after discharge home, and all infections detected are reported to Public Health England. This is a legal requirement for all hospitals. We do lots of things to reduce your risk of infection. So we've got nice clean wards, new theatres with a special canopy over the operating table called laminar flow, which just ensures clean air around the operation site at all times. All patients are swabbed and screened for MRSA and MSSA. Everyone probably knows what MRSA is. It's the superbug that's resistant to antibiotics. MSSA is the same bug, but it's sensitive to antibiotics. If you were having any other operation other than a joint replacement, we wouldn't screen for MSSA. But because you're having a joint replacement, we want to reduce your risk of getting a wound infection as much as possible. Around the hospital and at bedsides, there's hand hygiene and alcohol gel. We use special wound dressings, which I'll talk about a little bit more later. And there is a one-off dose of antibiotics given within an hour of the operation starting. And the surgeon will also use antibiotic cement around the new joint. Also, preoperatively, we use special warming blankets. Research has shown that people who drop the body temperatures are more vulnerable to infections and other consequences and complications of surgery. So now we warm you before the operation because we know an anaesthetic, whether it's a general or a spinal, can drop your body temperature by about 2 degrees. So warming you up before the operation stops you getting cold during the operation. We use special disposable blankets that self-heat and stay warm for 12 hours, and those will be given to you before your operation. During the operation, a different system of warming is used, and the warming blanket you use pre-operatively goes onto your bed to keep you warm after the operation. Things you can do to reduce your risk of infection. Eat a healthy, nutritional diet to help your wound healing after the surgery. A vitamin D supplement is recommended now, especially during the winter months, as vitamin D is being investigated currently to see what its role in prevention of infection is. If you're a diabetic, have a well-controlled blood sugar. If your blood sugar is very out of control, pre-assessment would not list you as fit for surgery. If you can stop smoking, please do. We know smokers have got a 10 times higher risk of developing an infection post-operatively. All staff should use alcohol gel before any care is carried out. If you see the staff entering the room and about to deliver any hands-on care, please ask them to use alcohol gel in front of you. If you have been tested positive to MRSA or MSSA, you will be given a body wash to use 5 days before the operation, and a nose cream if you are positive to any of those bugs, again to use 5 days before the operation. If you are positive to either of those bugs, we ask you to use the nose cream and body wash for 5 days after the operation, so please bring this into hospital with you. Ladies are advised not to shave their legs for 3 weeks before the operation, and please take care not to get cuts and grazes on your skin in the 3 weeks leading to the operation. If there are any new cuts and grazes around your operation site, please let your consultant secretary know so they can review you before surgery takes place. These are the dressings that we use. They are called Meplex. They are put on in theatre after the operation's completed and are designed to stay in place for 14 days. They are waterproof to allow light showering, but please do not put the full force of the shower onto the dressing. If there are any concerns about the sealing of the dressing, take extra precautions by covering it. Wounds do ooze, and occasionally dressings need to be changed, but we have a protocol in place Wound infections are a reality, they do happen. The national average for a wound infection is around 1%. What we do know is that the majority of wound infections are self-limiting and improve themselves. However, your surgeon will want to know if you have any problems with wound healing. These are the signs and symptoms. The skin around the wound will get red and sore. The skin around the wound may feel hot and swollen. There may be a discharge. Anything thick, yellow and green is of concern, or any offensive odour from the wound should be reported. You may feel generally unwell and feverish or have a temperature. However, some redness, swelling and thin straw-coloured oozing from the wound can be normal, and there also may be other reasons for having a temperature other than a wound infection. If you, your GP or district nurse have any concerns about your wound or wound healing, please contact the surgical site infection surveillance nurse for advice. Do not take any antibiotics prescribed by your GP for a wound infection unless your case has been discussed with your orthopaedic surgeon. Generally, your consultant will want to see you in clinic to confirm if the infection is there. Out of hours, your GP can phone the registrar on call at Cumberland Infirmary. After the surgery, the SSI nurses will come and visit you on the ward and give you our contact numbers and leaflets from Public Health England about monitoring your wound for infection. We will also phone you approximately 2 days after discharge and then again at 30 days after your operation. The SSI nurse and ward are available for advice at any time after discharge home.